Hi, my name is Raman Baweja. I am at present Associate Professor in Department of Psychiatry and Public Health Science at Penn State College of Medicine. Other than my professional life, I identified myself as an IMG, clinician, researcher, administrator, which is my new role recently, and a proud father, husband. That's about me. So I was thinking about this question for a long time, like why I wanted to be a psychiatrist. And I knew very early in my life I wanted to go in the medicine. Coming from Southeast Asia, my father was practicing medicine at that time, so I wanted to be a doctor. I think when I was going through the different rotation, at some point of time, I wanted to be the neurosurgeon, then orthopedic surgeon. I think the psychiatry where I really feel that okay, that's the place I fit the best. I really enjoy going to the my rotation. I think I think that was the time, those few weeks of my clinical rotation, first time, and I was in the psychiatry rotation. I realized that that's the kind of work I would like to do even 30 years from now. So that was the eye-opening answer for me. Okay, that is the field I would like to do. So I started with the APA, but then I become a child psychiatrist. Now I'm pretty active with our ACAP, and I am the committee member as well as the regular attendees of many committees which we have with the ACAP, Diversity and Inclusion Committee, Family Committee, as well as the Psychopharmacology Committee. So I'm variously involved in the various projects, as well as presented. I would say now multiple presentation at our national conferences. I recently become also more active with the APSUD, which is the American Society of Professional for ADHD and related disorders, and I am the co-chair of a communication committee there as well. Yeah, I have many stories. Always I look for the positive side, but definitely one story still I remember when I came to this profession. So this was the child at that time was 9 or 10 year old, was severe mood dysregulation disorder. I was the first few month of my inpatient rotation, just being a new fellow in child psychiatry division. So I started seeing her very dysregulated, and then we optimize her treatment, aftercare. And fortunately, I started seeing her on my outpatient practice and I joined in the same system. So I become her longitudinal child and adolescent psychiatry for her care as well. So it was so rewarding to see that she got accepted in the state college. Now she's doing, and her goal to be a psychologist one day. And that once she was out from the hospital, and I saw her in the first time in the outpatient, and that that she was so thankful. Even I was doing my job and like learning for me, but for the family, still they are very very thankful to me. I'm still following that person. She's in the nearby city, so we are. That is one of the very gratifying event, and many others who are like I started seeing when you're in the same profession for a long. When you see, and I'm sure Dr. Adam, you also there are many places when you see the patient and you see them grow and the hope you see in them as well as in their family, that is one of the very rewarding experience I have as a child psychiatrist. Child psychiatry is the wonderful field. And if you really likes, again, if you really likes to work with the kids, you really want to make a big change in their life. We have the opportunity. Unfortunately, we are in the era when we are going through the youth mental health is the psychiatric emergency, like nationwide concerns are there. It's the emergency, nationwide emergency. Our youth are struggling. If you really enjoy that, it is the field to help your youth and our nation, because that our youth is our future there. And listening to them, you are not helping them. You are also helping the whole family. You are helping their future. So there is a great work to do with this population. So that's I like to be a child psychiatrist. So definitely, I would say before the training and during the training was the more challenges, and then after the training. I think for being an IMG, child's IMG psychiatrist, So I am originally from India, coming from the Southeast Asia, that they're more in the patternistic approach, or that the EMR, or there was a lot of things to learn about that one. Not only in the professional side, you also have to learn about the local dialects. You have to learn about the idioms like people use here. I am from the central Pennsylvania. There is a lot of Dutch population around. And I think in many around the countries, people have the different accent, which can be challenging. One of the example I have it that I was on the intern and I was on the medical floor. I need to examine the light reflex. I asked one of the nurses, "Can I have a torch?" And she said, "Why you need the torch?" I said, "I need to see that the eye exam." I said, "But why you need the torch?" And then I figured it out that flashlight versus the torch, which was interchangeable on the other side of the world. So that was the kind of the small example. And I always sometimes say that I think during training, my supervisor was very attuned with my needs. They knew it like where I can have a struggle. So their support system was very helpful. And fortunately, the area I am, the patients was also very understanding, and they were very supportive. After finishing my training, that I think with time, it helped me to continue to get a culture to this system. I think that, but the initial part of the journey and during that part of the training, there was some challenges there. Yes. So for everyone, you need the mentor. Like we need the mentor. Either you're in the clinical practice or in the academics or in the advocacy or wherever you are. The more the like sometimes you said people say that you have the one mentor. I said, if you have the more than one mentor, go for that. I have one mentor who was helping me for my research career in ADHD and irritability and aggression. Then I have uh, my clinical mentor who was helping me to understand the different population, which is not my research interest, but still I need to do that one. And he was also my coach. He was also my where I can go and talk about balance between the personal and professional life, so that the more the mentor you have it, uh, it's good for you. And again, mentorship never stop. It is the lifelong process. You always meet with a more mentor. They can help you. So a few years ago, I started getting more and more involved with the diversity and inclusion. And then I met with Dr. Adam, actually, one of my mentor at the national level. And then I'm in pharmacology subcommittee. They are not identified mentor, but they are mentoring all the junior and mid career faculty. So yes, you need them either wherever you are. You need people you can guide you, suggest you, reflect you, give you the constructive criticism if you are moving into the right direction or not, or this path is right for you or not, or like you need mentors. So yes, we need all mentors, and I am fortunate. I have very good mentors in my. So I enjoy the mixture of things, I would say. Clinically, I think I briefly mentioned earlier that seeing our patient to get better, their family feel better, they're functioning at much improved, they are making their progress, they are becoming the productive member of the society, they are getting the education they need, they can settle down in their class. So that is a very gratifying area for me. Again, not all the story have the success. There are also some stories are not as successful, but we are doing what the best we can do to help those children. On the research side, I enjoy to explore what we are doing, either if it is working, if it is not working, why it is not working, and how to assess these patients and who are presenting with particular condition, and what we can do to make their level of functioning better, either through the pharmacological intervention or the psychosocial intervention, or the need for to understand what they need in the school setting. So I want to I like the exploring how to make this patient better. I enjoy working in that the ADHD and irritability aggression area for that. After graduating, I would not say that it's not affecting me. Once you are get a culture to this system, like as you mentioned, we are learning the field as well as we are learning about the system here and that local area things. Uh, I would not say that, and fortunately, I'm part of the country where I would say, except for one or two exception, when the patients was one or two patient in my whole life here for last 13 years, there was some concern, but I would say that are more outliers, but they were also very accepting. So I was very fortunate that I didn't face those challenges after when I would get the job and interacting in my clinical setting. So that's it's the combination of multiple things. Like mentorship was very helpful. I was open for that for the feedback, and I was open for that. The even my like evaluation or my annual review was always good. I was seeking. I think thank you so much for that, the positive thing. But I would like to know where can I have the opportunity to grow or improve. I think I would suggest that opening yourself for that to get better can help you to overcome these obstacles. And other than that, you have to learn to be persistent. Nothing is easy. You have to continue to do that. When we all get rejected paper, we all get have the disappointment in life, but the persistence will take you to the long way and the far away with that one. And the other thing, I think, like whatever the best professional you are, that you need to learn how to balance personal and professional life. If we have to make a compromise in your professional life to have the better adjustment between your professional and personal life, you can have it. At one point of time, I could have go faster, but at that time, my kids were very young. They needed me more. But now they are in teenager. They don't need me as much. So I get the more focus on my. So these are the things you can like being persistent, hardworking, open to learn from others, and always learning approach is going to be help you to obstacle all that the challenges you're going to face in your life. So I think the science or the health science was always attracting me on that one, and at the same time, I also like the psychology in the college, reading about the Pavlov experiment, and I think those kind of things always help me when I see retrospectively, like why I came to the psychiatry area. I think that I just combine my two interests together to know about the health sciences, know about the body, know about the brain. At the same time, I was also interested in psychology. So I think those are all these things work together, I would say. So if you really like to work with kids, you really like to work with the difference in the life of the people. Again, you are coming into the medicine either on the physical side or in the mental health side. You're going to make a big difference in their lifetime. And that is the gratification of helping those who need us. And we are in the national crisis for not having enough professional to help our youth, which is impacting our future. Like these generation changing culture is putting the more and more youth in the mental health crisis. So again, it's fascinating word, and you have a flexibility to work how you want to work. You want to work in the outpatient setting, inpatient setting, medical hospital setting. You want to do for the education side. You want to go to the research side. You want to go to the advocacy side. So you have a multiple way how you want to channelize your energy, your interest in this beautiful, very attractive field of the child psychiatry. And one of the things our leaders in these specialties are like very caring, nurturing. And if you have any interest as a high school student or as a medical student or as a general psychiatry resident, go and approach to your child psychiatry faculty either within the system or at the national level. We always welcome our trainees either in the general psychiatry residency, or if you're trying to explore this field, you are most welcome, and you are going to be very welcomed and received in the our national conferences as well. And I many of the college student, they do sometime they come to and rotate with me for a day or two to see what the child psychiatrists do. That can also help you to understand about this field. So I would say it is a great field, and you enjoy working with the young kids from preschooler to the adolescent to that transitioning age group going to the college. You work with the whole generation who will be the future, and you help them, you listen them. You're not only helping this child, you are helping the whole family or the society or the whole nation. So welcome in the child psychiatry. Thank you.